The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
It's been a little over 2 years since the beginnings of COVID-19, so here to share what we've learned and how we treat the virus, we welcome Providence Infectious Disease Specialist, Dr. Tobias Pusch is with us today. Dr. Pusch, thank you for joining us.
My pleasure. Thanks for having me.
It's pretty wild that we've come across this 2-year mark. You know, what was it like when you first started seeing patients 2 years ago with COVID?
Oh, wow. It couldn't be more drastic than what we're doing right now. Obviously, we had no idea what we're really dealing with. There was really no research out. It was a completely new disease. So, you know, starting from scratch and extrapolating of what was done overseas someplace with no therapy at all whatsoever. And now we have treatment from, various kinds, attacking the disease literally from the beginning to the end, and have lots and lots more knowledge in terms of supportive care, what we can do.
Yeah, I'm sorry. Can you share a little bit more about those go-to treatments that you had back then and how they compare to what you have now?
Well, at the beginning, it was really just experimental. Yeah, we would extrapolate from what's available in the test tube, and there's potential evidence sort of initially starting off with just inhibition in the test tube, but not clinical data in patients. And older compounds literally were investigated and then brought into clinical practice. And now we have 2 years worth of research data, and we have medications that have, hard clinical endpoint data available that we deploy, and many more have from the beginning on been developed. So we have truly now evidence to support what we're doing works.
Yeah, we do know that with the arrival of Delta and Omicron, that you're seeing vaccinated people and unvaccinated both get the disease, suffer. What were the comparisons for you, the number of vaccinated people that you treated versus unvaccinated?
Yeah, the difference remains very significant. So, it's been debated quite a bit, right? How much vaccine impact is there? And there clearly has been slightly less now with the new Omicron variant. The vaccines are less effective, however, still very substantially better than not being vaccinated at all. The Omicron has been more favorable in terms of seeing less hospitalization rates, less death altogether compared to the Delta variant. But there's no doubt about it, no fuss about it whatsoever. Get vaccinated, the vaccines work, and there's a substantial difference between being unvaccinated, having just the primary vaccine series completed, or even one step further, being boosted. So it's clearly much, much better.
And there's so much fear around it, as well as like what's to come, right? What does the future hold for this disease? We're already seeing a new variant. What are we seeing here?
Are you referring to this new Omicron variant now?
Mm-hmm. Is it Deltacron? Is that right?
Well, the new circulating strain is really sort of one that's similar to the Omicron. The initial Omicron was titled as BA.1. The new one is now BA.2. There's a couple of sublineages that the CDC is following and tracking in terms of their prevalence. What's now sort of moving around in the news media, Deltacron, there's not really a scientific basis on that yet. This is really more sort of news reports, and it's really not clear what that represents, if that's truly an entity at all.
Talking about vaccinations, what is the outlook for that? Is there going to be an annual vaccination, do you believe? The boosters every few months?
Well, that's a really good question. So if one thing we learned over the last 2 years is that prediction of what is going to happen is really difficult. And I have to say that, many of those predictions have not held true. So, will this be truly influenza type yearly vaccination? Will it be more have to be tailored according to new variants that come out and completely new vaccines having to be developed for this? I think it's way too early to say. For the last several months, as we've seen that vaccine effect after several weeks sort of starts to wane with the new variants, I would very much envision that we need new vaccines for healthier populations, probably more so as a colder season arrives again in fall. For more immunocompromised individuals, probably much sooner than that. But, the last word is not spoken there.
Dr. Pusch, thank you so much.
My pleasure.
And you can contact the Providence Infectious Disease Clinic at 503-216-7000, and we'll have more information on our website at KATU.com. We'll be right back with more Afternoon Live right after this.